Here in Greater Manchester, we want to create the conditions for everyone to live well, whatever their age and wherever they live, to give our children and young people the best start in life, to help them thrive at school and transition smoothly into adulthood and successful working lives, and to help everyone stay healthy and age well. To foster health, hope and human connection in all our communities.
For the past decade, we've been working together as partners to rethink the way we deliver public services, treating people as names, not numbers, and building a system that provides early help and heads off problems before they reach a crisis point. We've built momentum, and now we're ready to create a blueprint the rest of the country can adopt.
The government has backed our approach and made us the National Prevention Demonstrator. Working with government, we're going to test the hypothesis that investing in prevention is better for people and better for the public purse.
The current national model isn't working. Our NHS, councils, schools and housing providers are struggling to cope with unsustainable demand. And so is our voluntary, community and social enterprise sector.
They're all so busy helping people in crisis, it's hard to tackle the root causes of their problems. And we want to change that.
In 2025, we launched the Greater Manchester Strategy, which represents a doubling down on our commitment to prevention. It sets out our vision for a thriving city region where everyone can live a good life, and a 10-year programme to fix the foundations of life and support people to live well.
Our Housing First unit is delivering healthy homes for all in safe and strong communities. Our Live Well approach is embedding everyday support in every neighbourhood so people can live happier, healthier lives. Our MBAC is giving our young people a clear line of sight to high-quality jobs, wrapping support around them to give them the best start in life. And we have a plan to bring good growth to every part of our city region. Now, as the National Prevention Demonstrator, we'll gather data to measure the difference our strategy makes to people and the public purse. It's the UK's first ever attempt to quantify the human and economic benefits of shifting spending and effort from crisis to prevention. We're uniquely placed to lead this work. As pioneers of English devolution, we have the UK's most integrated public services and the funding flexibility to put prevention at the heart of everything we do. And we're international leaders in using patient data to predict problems, make better decisions and drive innovation.
The Prevention Demonstrator will start by measuring our work with 4 groups where we see the biggest potential for rapid progress and savings. We'll start with our work to help people who are unemployed or at risk of unemployment. We'll test the impact of tailored support to help people overcome health and social barriers to employment, and timely support for those who are in work but struggling due to ill health to help them to stay in their job. We'll also measure the impact of bespoke support for people with complex needs who are stuck in a cycle of crisis. By meeting people where they are and helping them overcome problems and traumas like homelessness, addiction, domestic violence and contact with the criminal justice system, we can help them get their lives back on track. Thirdly, we'll gather data to assess the benefits of early intervention and support for children and families. This includes helping schools to access the resources they need to meet the needs of every child and family, providing earlier community-based family support, reducing the need for children to enter the care system, and making sure parents can work as their child is at school.
Finally, we hope to show that by helping people with unmet health needs to access the right clinical care and lifestyle support, we can reduce deaths from heart attack and stroke and reduce hospital admissions. We'll start in the places that are best equipped to lead the shift towards prevention. Working with government, we'll spend the first 12 to 18 months gathering data and using it to test and perfect our model in those communities. We'll spot what works and then roll it out across Greater Manchester. Within 3 years, every part of our city region will have made a more radical shift to prevention. One that improves lives, saves money, drives good growth and gets our public services back on a stable footing.
By 2030, the way we deliver public services will look and feel very different, with the communities facing the greatest challenges feeling the biggest benefit. Our Prevention Demonstrator will have delivered an evidence-based blueprint that can be used across the UK.